The more specific the code is, the better it shows your particular patient's condition. And then that code is used for a lot of reasons. In the United States, we're using ICD-10 for billing. The rest of the world is using it for healthcare statistics. I think one value is that we're speaking a language here when we are talking about codes. So the language of healthcare is our coding system. And our old coding system, ICD-9, which has been around since the 1970s, is really talking in archaic language. You can, out of one ICD-10 code, you can get a lot of information. It's almost like a shorthand for a whole paragraph of descriptive narrative. Inpatient charts are going to be impacted in several ways. From the test ordering standpoint, to order a radiographic test or order a lab test, going to have a more specific indication, and that helps show the medical necessity for why that particular test needs to be done. Just using documentation that the provider is already putting into the chart, we'll be able to generate these more specific codes. A lot of codes in ICD-10 are going to be combination codes. CMS is providing physician profiles online, so you'll be able to look to see, gee, how many patients has my doctor taken care of with my particular problem, and what kind of complications have they had, and all that information is going to be out there public. And so the most accurate codes to show that you're taking good care of your patients without complications, that will be important data to share. The famous problems and diagnosis list. For meaningful use, the hospitals are now having to generate electronic lists of the current conditions that are being treated, that's what's called the diagnoses, and then the chronic conditions that the patient has that will affect them across encounters. And those are considered the problems, and the problem list will build on itself with recurrent hospital stays.
To aid in the development of the Diagnosis and Problems list, Cerner has developed the Diagnosis Assistant tool. The Diagnosis Assistant is available in PowerChart to help providers select the best ICD-10 diagnosis. Step 1. Enter the diagnosis as you normally would. When you see an exclamation point, a more specific diagnosis may be available. Click on the exclamation point to open the Diagnosis Assistant. Step 2. To select a more specific ICD-10 diagnosis, select from the options presented across the top of the window. Step 3. As you make your selections, the list of diagnoses will narrow based on your selections. Some sections may dither entirely. When you reach the most specific diagnosis, the Diagnosis Assistant says Done in the lower right-hand corner. Click Save to close the window and update the diagnosis list. The updated diagnosis list will display a bullseye icon.
Education, education, education through Munson in various ways, both for our employed physicians and for people like me in private practice. They need just general education about ICD-10, and then specialty-specific education, which Munson is also providing. And a super bill could go on for several pages, so they have to, each group's going to have to figure out how are they going to generate those codes and how is that bill going to look. I think they need to take a deep cleansing breath and not get too worried about the fact that the codes are expanding so much, and just focus on what's important in their daily practice.